Hi, happy Thursday instead of
Hap-
Wednesday.
Happy Thursday. I sat here in silence going, I wonder if she can see the live button. I know I can. So
I couldn't because I had all kinds of stuff going on in the background. So I'm gonna close my browser out now. And but I mentioned I'm hardwired in today, so maybe my my connection will be a little better. We won't have as much lag as we've had in the past. So
well, that should be good too, because I actually had a new network installed last Tuesday. And so I
right.
am screaming at about 600 megabits. And I have hardwire and wireless and all that good stuff. So
Yeah, I can tell. I knew you were going to do that, and but I didn't. I forgot about it. But I can tell that you're not lagging like you normally do. You not a lot. You didn't normally lag a lot, but you did lag a little bit. So anyway, we're both good. I think we're both good. So first, let's identify the elephant in the room. I know that you have been wondering, and I have my hair down today. It's not up in a ponytail on top of my head. I know you were confused. You didn't know I had hair, did you?
I did look, you were glowing today. And it's really interesting. And I know you have a topic for today,
I
but
do.
everybody in my eyes is beautiful, and they have their own sense of beauty about them, their own uniqueness, and that's why I love, one of the reasons why I love what I do. And so when I first saw you, like I told you, I go, you're just glowing today. And I don't know if it's all the rocket launches or your time on the beach or whatever you're doing, but you have a special shine, and I wanted to tell you because it's noticeable. And you know what, we like to hear those things too, especially when they're
Yeah.
authentic. And so
Yeah.
you look great.
Thank you. Thank you. And I will say that I took our conversation last week. We talked about stress and, some of the things that we can do to mitigate stress. And I have applied some of those principles. And so I'm working on it. Every day is not a glow day, but today is. And thank you for noticing. So that being said, I didn't introduce you. So for the people who are new to our interviews, this is Dr. John Rothwell, FNP, right?
Practitioner, family nurse practitioner.
Man, look at that. Look at that. I almost got it. I don't know about all those other letters, but we're not going there. So FNP, I got it. There, go me, go me. Okay, so Dr. John Rothwell, FNP with Island Direct Primary Care, which is in Merritt Island, and you are my personal doctor. And I know there's the whole, doctor thing, family nurse practitioner, but I'm very happy that you are my healthcare partner. And thank you for being here with me every week to talk. I'm Janice Polk. I am a marketing consultant in Cocoa Beach. And today we're going to talk about something that I know a lot of people have dealt with recently and is a pretty hot topic. Well, I say it's a hot topic. I haven't heard a lot of people discussing it, but it's definitely something that I've seen, and that is restricted access to healthcare. Since the pandemic, and you don't think about it unless it affects you directly, but then when it does affect you, you're just kind of like, oh gosh, what do I do now? And I had it affect me directly. When I had an issue, I needed to see a specialist, and nobody would see me for various reasons. And then my granddaughter actually, I think it was last week, woke up in the morning with a sore throat, couldn't go to school because we're actually observing now, not sending children to school when they're sick. We should have always been doing that. But my daughter-in-law took her to an urgent care facility to get her checked and really thought it was just sinus drainage, not a big deal. But it had to be checked. She gets there to this urgent care facility that normally you would just like walk in and get to see a doctor. And lo and behold, they're like, stop, nope, you have to make an appointment because we think you have the cooties, and we can't see you until tomorrow. So she was able to find a facility, but it was a big issue, and she ended up having strep. So there's a lack of access now. When I had to see a specialist, I had just been out of town, out of state actually, and just over the border. And I mean, let's face it, we're the ones that have the cooties. Nobody wants us from Florida, but nobody wanted to see me. They wanted me to quarantine for 14 days before they'd see me. And I was like dying. I don't have 14 days to wait for health care. So it's crazy times out there. Are you seeing some of that in your practice, in your community?
Yeah, I think in the community for sure.
Yeah.
Not in my practice because I've made myself available from the day I opened my doors, right? And so
Yeah.
access is one of my big value adds, so to speak. But interesting to note is, when I was working in the emergency room, one of the local emergency departments here, we were seeing about 150 to 170 patients a day. Currently, right now, they're below 80. Okay. And so part of that is because
Wow.
part of that is because people don't want to access the emergency room because fear.
Yeah, for
And
sure.
yeah. And then when it comes to common illnesses like your granddaughter and other people, it's like they call their primary care provider. And if they have one of X number of list of signs and symptoms of COVID-19, even it's something as simple as sore throat or a rash or, abdominal discomfort or pain and diarrhea, while those are kind of not one of the top signs and symptoms, surely there's documentation that says that they may be. And so primary care providers or private practices, they don't want to expose their staff and their clinics to, the
Sure.
risk that comes with that. And so the first thing out of their mouth is, send them, you're going to have to go to urgent care. You're going to have to schedule an appointment. And the urgent cares in Brevard County are all doing a lot of things. As you know, I've been part of leading the COVID task force for Dr. David Williams for MedFast. And so I'm quite aware of, how successful at least MedFast has been in mitigating the access to care for patients in need. And there's one thing that's pretty common that we remind our providers all the time, and that is common illnesses are still common. Whenever someone comes in with a fever, sore throat, and cough, you're not doing a chest x-ray and shoving a swab in their nose and testing them for COVID, unless you've already ruled out influenza, you've ruled out streptococcus, you've ruled out mononucleosis or Epstein-Barr virus. I mean, there's other things that you need to look at because common illnesses are still common. And remember, COVID-19 is one of 7 coronaviruses, and 4 of those coronaviruses made up 10 to 30% of our upper respiratory infections. So, we still need, as healthcare providers, we still need to do our due diligence in making sure that we look at all the differential diagnosis for our patients. But when it comes to access, we should be doing that too. If not, we're going to lose continuity of care. And continuity of care is huge. And so, for example, it's one of the reasons why when you needed to see a specialist, we were both actively involved trying to find someone to care because we want to make sure that there's no fragmentation or communication gap in what's going on. And so if just for basic stuff, people are having to go outside their normal practice, we may actually lose that continuity of care. And so what if it's something more than just a cold, COVID, strep, or something like that? And that's not great for the community, right?
Yeah, absolutely. Absolutely. And, I realized when I had to go see that specialist just how spoiled I am, because I hadn't thought about this at all. When I got sick initially, I sent you a message via your system, your messaging system. I didn't even make an appointment or call or anything. I just sent a message because we all just text and that's what it feels like. And I sent a message and said, hey, I'm in trouble. I've got an issue. And, and we communicated about it, and it was like easy peasy, light breezy, which is my thing. And then the next day I was worse. And and again sent you a message at like 6 in the morning and was like, hey, I'm in trouble. I need to talk to you. And within a couple of hours went to your office, and saw you. And so it didn't occur to me that there is an access to care issue out there until we decided I needed to see a specialist. And then we started, jumping through hoops. And when I did eventually find one, it worked out really well. After I jumped through the hoops, I did find one. Persistence, is helpful. But even then, when I went there, so I got to the door, and here's something that was interesting too. So I got to the door and they had a young lady sitting outside with a clipboard and a thermometer. And so you walk up, she was very nice, and she walked up. First thing she did was take my temperature. I didn't have a fever. I didn't have any COVID issues. It was something else. And then she asked me this series of questions, which luckily for that particular practice, they did not ask if I had been out of state, because I don't lie well. I would have had to say yes and then go home and cry, but I didn't have to do that. So, but the questions were, have you had any COVID related symptoms? Have you had a fever in the last, 2 days or something? And they were all related to, do you potentially have COVID? And that was interesting first, like gatekeeper. And then when I got inside, the chairs were all 6 feet apart, and marked, and there were, some were taped off. And of course they had the plastic at the reception desk and a big sign that said, stand directly in front of the plastic, because, you could kind of go around the corner. And I think people are still acclimated to doing that because we still crave that, person to person connection. It was interesting. They had it all handled very well. They took very good care of me. I was thankful that I found them, but all that to say, you have me spoiled.
Well,
and I'm glad.
One of the things that I put in a few weeks ago in partnership with Hybrid Networks, and they're the ones who set up my network here in my practice and fixed MedFast to make it look nice and clean. One of our veteran-owned businesses that I work with. Anyways,
Nice.
So now I have a smart scanner, and so when you come to my office, it's touchless. So you look at it, it scans your body temperature and then verbalizes it to you, so we know what your body temperature is within 0.03 degrees. And then it tells you whether you need to put a mask on or not. And so so without having to touch anything. And so right when patients walk in the door, even though they're pre-screened, obviously we talk, I know my patients and I bring them into the office. Any of my COVID patients, I'll actually test them and screen them and all that stuff outside. So, or at their home. So I've done quite a bit of home visits for people who were, possibly were rolling out COVID. So.
Well, this is a real argument in my opinion, and I am not going to apologize, but for this, because it's definitely a shameless plug for your approach to healthcare. But which I love. I'm not ashamed to say that I'm a real advocate for the way that you provide healthcare. I love having a healthcare partner. But I think that, it's just a great argument for why this type of approach works better than a traditional healthcare system, because we are partners. And it didn't even occur to me that I would have a lack of access to you. And I don't, but I think that a lot of people who are not in a direct primary care type environment are seeing that. And it may be, I always am interested in the long-term effects of short-term changes. And so I could see there being more of a shift. In my business, I've always had the ability to communicate with people like you and I are doing right now. I've always had the ability, always, for several years, have had the ability to do video-based conferences and consultations. And I did None of them. Nobody ever wanted to do that. They wanted me to come to their office, or they wanted to come to mine. And now it's like all I do. And it's going to stay that way, even when things go back to normal, or if they ever get back to normal. It's going to stay that way because it's so convenient, and it works better than the way we were doing things previously. So my hope is that people will start to really understand the value, not see the value, but understand the value of building a partnership with their healthcare provider like you.
Yeah, it has to be a partnership. We do everything shared decision making. You have to own it, but I have to own it with you. I need to provide the resources and the information for you, or the evidence behind recommendations and suggestions. I mean, healthcare in itself is much more than the absence of illness, really, right? And
Yeah.
so, identifying what the actual problem is. I mean, there's a price we pay for the way healthcare is today, and direct primary care is trying to change that, right? I think it's common knowledge that we know that our system's broken, and whether it's an access issue to the pandemic, I would argue that there's an access problem before the pandemic. You call your provider, I can't get in for 3 or 4 days.
Sometimes longer than that. Sometimes it's weeks.
Yeah, I'm talking about for like a sick illness. If you're trying to schedule a physical, then all of a sudden, you're trying to schedule a physical and you can't get in for a month, but you need it 2 weeks from now. It's like, really, 2 weeks from now? And part of that is because, and look, in reality, this isn't, in my humble opinion, necessarily any fault of the primary care provider. They get a certain amount of money reimbursed per visit. And so they have to see X number of visits in order to make their business model work, and then cover their overhead and stuff like that. I don't have that, right?
Right.
Which means what? Which means that now I can focus on you, and I can focus on my other patients. It's funny. So one of my newer patients this morning sent me a text and goes, do I need to schedule a virtual visit with you, or can we just have a conference? And so I said, I'll go ahead and schedule a virtual visit for you in 10 minutes if that'll work. And she said, that's fine. So I went ahead and scheduled it for her. And I go, when you said a conference call, I thought I was in trouble. I felt like I was and she goes, well, I just don't necessarily, I'm just getting used to how all this works. And
it takes a minute. It does take a minute.
Yeah. And I'm in the process of trying to work on communicating that with new patients as I grow, right? And but it was interesting to just be able to see that process for her, because she just didn't really expect to have access that quickly, right?
Yes.
But she's, it's it's a great thing to be able to increase access to care. And like I said before, I thought, and this is a misconception about direct primary care, and even my friends when they're communicating, and that's probably my marketing inexperience is, people love to talk, my friends and my patients love to talk about Island Direct Primary Care. And I'm so grateful. And it's interesting because they always throw, if you don't have health insurance. And the funny thing is, and it's not funny, but the thing is, 80 to 85% of my patients have health insurance already when they come to me. And so direct primary care is not a substitution for health insurance. Catastrophic health insurance is important for those major traumas and accidents, or, heaven forbid, a cancer or some kind of thing like that. Right. So you need to have some kind of high deductible catastrophic health coverage. But, I thought also that the people who would be selecting Island Direct Primary Care was that 30 million people who fell in the healthcare gap. Now more, right? Because, because of the pandemic.
Which I'm one of those people. I am one of those people. I don't have a major medical policy, but even when I have one, which I will, hopefully in the near future, you're stuck with me because you're my go-to, like you're my director, you're my air traffic controller is the way I kind of see you, I don't ever not want to have access to you. You're, the first person I'm going to go to, and you're the second opinion I'm going to get when, if something, heaven forbid, were to become an issue. But you know what? You said something that made me think about something I hadn't thought about before. So I am the kind of person that loves different. I love anything new and different, interesting. I'm a first adopter. I like trying new software, new products, and things like that. So for me, this different approach, made me sit up and go, oh, well, what is this? It's a different approach. I like different. Let me see what it is. And I'm not intimidated by different. I'm not intimidated by change most of the time. But even still having that nature, when I first started seeing you, I was really super sick, which is what made me pull the trigger, looking for care. But I was very confused. I have to admit, I was very confused about how it worked in the first week, probably, that I was, consulting with you. And it took a minute, to be like, oh, okay, this is how this works. But once you do, you're like, oh, cool. I like it. Yeah. Yeah.
Yeah, we're trying to, it's I say when it's just me and building the processes and getting it out in front of the consumer, in front of the community, first and foremost, it's tough. It was one of those things for me where I knew access to care is a problem. I did part of my doctorate work on access to care. And so, when you're a nurse practitioner, typically you work in an environment that has a medical doctor or doctor of osteopathic medicine, or a hospital facility or something like that, and you're working for someone. And I like to work with people. I like to work with my patients and those kind of things. So when I came up with something new, I had a choice. I had to leave a very stable environment that provided a great living for myself and my family, or I had to take a leap of faith and just say, you know what? I believe this is what's right for the community. I believe this is what's right for healthcare. This is what I believe, and I believe I can help influence change. And so I just quit my job and jumped in with both feet, right? And so I just made sure that the I's were dotted, the T's were crossed legally. And I got Dr. Williams to, buy in on the collaborating agreement so that I could practice and open up. And I just did it. And so, so we're growing. Interesting enough, that being said, I actually just hired 2 part-time people yesterday. They just
awesome.
And so I have a nurse practitioner student who is a registered nurse. So we have a registered nurse part-time on staff, 10 to 20 hours a week, depending on her school schedule, because that's most important to her and me. And then also we hired a nursing student who she's not yet a registered nurse, but they both graduate in a year. And
nice.
So, and this provides a great mentoring environment, but a great service environment for them and an opportunity for growth for them and myself. So
very nice. Well, first I want to apologize for looking at my phone while you were talking, but somebody messaged me and I wanted to make sure that our live stream hadn't pooped out on us, and it hasn't. So, but I wanted to say about, saying that when I first signed up and first started, seeing you and consulting with you, I was very, very sick. I've thought a lot about it because, I'm a systems person, I'm a solutions person, and I'm always trying to solve everybody's problems, whether they want me to or not. And because I've thought, well, how could he better describe, the concept of direct primary care and how it works and that sort of thing. And I've come to the conclusion you really cannot. I think you can only do what you have done, what you have explained on your website and the things that we've talked about. And the fact of the matter is you just have to experience it. And, consultation with you, of course, is good, but even still, there's still going to be a little learning curve there. But I'm going to stop just like shamelessly promoting, because I do believe in you that much and I believe in the concept that much. But let's go back for just a second to the access to traditional care, which is not better, but just traditional, just different. So what is your advice beyond being one of your patients? What is your advice? Say my daughter-in-law, which she did the troubleshooting necessary and she was able to get her daughter care, which is great. But what if you can't? I mean, what do you recommend? Say you're a mom and you've got this child and they're sick and nobody will see them and they want them quarantined, or whatever. What do they do? What do they do? Go to the emergency room? Right. I mean, that was the thing for me. We didn't want me to go to the emergency room because it's full of people who we know are sick, and the chances of being exposed to COVID are so high.
Or should be sick, right?
Yeah.
It's interesting. I think one would argue that 56%, 60% of emergency visits aren't actually emergencies.
Yeah.
The nice thing to know about the emergency room census right now is that hopefully it's lower, but hopefully it's actually true emergencies that they're seeing, and they're not seeing people who don't necessarily have health care, and so they're just walking in the emergency room because the emergency room by law is required to take care of them, and they have a cold or a toothache or something like that, and then that does happen. Not to take away from the fact that a toothache can actually lead to some very serious problems.
Yes.
So, but that's the challenge, right? You have Dr. Google, and so usually that's where everyone goes.
Yeah, which always scares the devil out of me. I have almost died so many times, right? According to Dr. Google.
Yeah, my daughter too.
Yeah.
And so one is, you call your primary care provider, and that's first and foremost what you should do, and say, listen, what do you guys, how are you guys seeing patients during the pandemic? Are you seeing routine care, physicals? What's your rules of engagement? And get a good understanding there, and then just ask them and say, look, this is what we have. Our risk of exposures limited to, I had a patient recently who, they're home all the time, and there's no reason their risk for COVID is minimal. Baby gets sick, and then not baby or young toddler gets sick, and the daycare is like, no can do, quarantine 14 days. And so it's a struggle for families because they really don't know what to do. Urgent cares are great. They're designed for a purpose. They provide good urgent care. Go to one, if you need to go to one that your primary care is familiar with, and so that you can hopefully keep that continuity of care if possible. We're doing a lot of stuff for virtual health. For me, I'm very comfortable with it. I studied virtual health for 11 years. I provide virtual health as part of my practice. So I like virtual health. You can do it cost effectively. For example, if you're not a member of Island Direct Primary Care and you need care, you can actually go to MedFast website, and for $59, you can get care for things like UTI, sore throat, and stuff like that. And there's a number.
That's a great idea. That's great. I didn't even think of that.
Yeah, and so that that increases access. They've all been trained on how to do an assessment via virtually, and at least say, what, I need to put hands on you, or what, let's do this for this many days, and we'll try this, and if not, then come in. And so there's obvious risk with that, but that's our job, right? Is to understand risk and benefits. And so there's a big difference who a mom calls and a child has a temperature of 102.5, has sore throat with swollen tonsils and what we call actually the little pus pockets back there, the glands are swollen, and no cough. That's four out of 5 symptoms of Streptococcus pharyngitis, which is strep throat, right?
Yeah.
And so, and then if it's a child's like 6 years old, they might have a belly ache because that's really common. 5, 6 year old, I get a tummy ache, and I go, "Did you look in their throat?" I tell my students that. They're like, "No, it's their stomach," and I go, "No, they're 5 or 6 years old, and they got this. It's probably strep." And they open them. Oh my gosh, look,
Yeah.
So
Yeah.
I can do this over the telephone. So now what I've done is limited risk of exposure to people who may be at a facility being tested for COVID. And I've also managed to increase access to good quality healthcare to my patients. And so it's one reason why it's not an extra for my patients. It's in collaboration with, and better than anybody is that I get to know you so well that when we do talk,
Yeah.
it's very comfortable. And I can say, you know what, which I've done, I need to see you.
Yes. Yes. You've done that with me. Yeah. So
So
that's good. I can't believe I didn't think about that, but yeah, that's the perfect solution. That's the
it's
perfect
like,
solution. Yeah, it's
so,
great.
and a lot of primary care providers are starting to get into it, but there's a transition and there's a technology, there's a learning deficit that comes with it. And some people aren't comfortable. Look, we're in an aging community. And when I say aging community, I'm not just talking about Brevard County, right? Our country is aging.
Yes.
Baby boomers are getting older, we're living longer. And, if you look at some of the data by 2025, we're going to have this big shortage of nurses, big shortage of physicians. And so that means these guys are getting old, guys and gals are getting older.
Yeah.
And so to do something new and different like this
Yeah.
is uncomfortable. And so we're
Yeah.
like, you know what? I'm not sure if I want to do this. So they're kind of sitting by the wayside and waiting to see what happens. And then you got guys like me. So I'm kind of like you. I like to be an initial adopter versus an early adopter or late adopter. So I want to be a first adopter, right? And so I've been studying telehealth for a long time. I know the back end of the technology. So for me, I'm like, look, I can increase access to care this way. I can increase availability this way. I can provide care affordably this way, right? And
Yeah.
so when we look at it from that perspective, it's kind of like, wow, I can use modern technology, but really kind of give it that old school feel, right? To where it's personal and personalized. So, I'm kind of from a marketing perspective, right? And this is my own channel, kind of being able to offer healthcare that you need at a price that you can afford. And
Yes.
that's really where it all begins, right? So
Yeah. Okay, so in a nutshell, we're gonna wrap up. We've been talking a long time. We are so talky.
you're feisty today.
I am feisty today. I make no apologies.
It probably needs to be your Friday and you ready to go.
I know. I'm thinking about that. Yeah. So wrap this up. You are right now at this point in time, maybe not always, but right now you are offering virtual appointments for people who are not in your membership. Is that right?
Yes,
okay.
I do. But to be honest, since COVID started, I've only done a handful of them. They're kind of going to the big things, but yes.
Well, they may not, maybe just be because they don't realize it. So I will make sure. I can't believe I didn't think about that. But that's a wonderful alternative to lack of access when you really need to just talk to a doctor, that option is there. So I will put that in the description of the video, make sure that people are aware of it. As always, I appreciate your time. It's always great. I look forward to talking with you, and I always learn something new from you. And I appreciate you being very nice to me today. Thank you.
What do you mean today? I'm nice to you all the time.
Okay, all right. You're always nice. So you have a wonderful, wonderful day. Maybe next week we'll do it on Wednesday. We rescheduled, but nobody really is paying attention yet. I don't think we've got people acclimated to our every Wednesday, but we're getting there. We've got some people who follow us. And speaking of, I didn't say, I have not checked the feed. I have not checked any comments. Not going to be able to do that today, but I will check it after. And if there were any questions or comments that that need to be addressed, we'll talk about them next week when we meet again.
Great. Well, thanks for having me, Janice. I appreciate it. You have a wonderful, safe weekend and keep that glow.
Thank you. I'll do that. I'm going to sign us off now. Let me see if I can find the control to do that. Stop live stream. Bye, everybody.